We should always remember that knowledge is power, so any individual has the capacity to assist or help in any emergency situation as long as he or she is properly informed. So ALS is known as amyotrophic lateral sclerosis. It's a group of neurological disorder that involves nerve cells wherein the nerve cells gradually break down and die. So it belongs to the motor neuron disease, meaning motor, movement, motion, motor nerve cells. These are group of motor nerve cells that are located either in the brain, known as the upper motor neuron, or the lower motor neuron, which is in the spinal cord, that extends through the muscles. So when these motor neuron nerve cells rather die or degenerate, they would fail to send impulses to the muscles. Eventually, these nerve cells would not be able to initiate or control the voluntary movement. This would include difficulty in walking, difficulty in swallowing, and even performing normal activities of the daily living. There would also be muscle twitching or cramping of either the shoulder muscles, the arms, the legs. Actually, I consider all cases as a challenge because, for example, a simple case of headache can be different from with different patients. The level of pain, intensity, the location, the duration, and the different characteristic of headache and other signs and symptoms vary with each other. So the treatment approach I use for each patient are different. They are tailored fit. So, for example, the medicine A or a medicine is very effective for one patient but may be useless for another patient. So it's all cases are challenging. No test can diagnose ALS. There are tests that are being performed because they can mimic ALS. So, ALS is diagnosed based on detailed history taking, detailed neurological examination, and based on the signs and symptoms presented by the patient, as well as a series of tests that are being asked or performed by the physician. So, one of the tests that is being asked would be the EMG-NCV, which is the electromyogram nerve conduction velocity, wherein the physician inserts a needle through the skin to the muscles to determine any abnormalities in the conduction of impulses to the muscle. Thereby, one would be able to determine if there's abnormality of the muscle to rule in or rule out myopathy. And then there's the nerve conduction velocity or the NCV part, wherein nerve impulses are being tested to determine the nerve activity. So this study also measures the nerve's ability to send impulses throughout the body. So if there's any abnormality in the nerves, it can be detected through the nerve conduction velocity. Another test would be MRI of the brain and spinal cord, and other diseases can be seen in the MRI, such as stroke, inflammatory conditions, demyelinating diseases, infection, or tumors. Blood and urine tests can also be taken. A spinal tap or a lumbar puncture can also be done, wherein the sample of spinal fluid can be sent to the laboratory. A muscle biopsy can be performed, wherein a sample of your muscle is being tested if your physician is thinking of a muscle problem instead of ALS. No cure has been found for ALS. However, there are available treatment options to somehow prevent unnecessary complications, control the symptoms, and make life worth living for them. ALS requires a multidisciplinary team approach. It consists of a team of healthcare professionals, which includes physicians, physical therapists, occupational therapist, respiratory therapist, nutritionist, psychologist, as well as nurses to provide an individualized treatment plan for the patient, as well as to provide adequate equipment to make life easier for them, to provide proper nutrition, as well as to make the patient more comfortable and to make them more mobile as much as possible. Yes, it's a very costly disease because number one, it requires a multidisciplinary team to care for the patient. Number two, the medicine that is used for ALS, which is not actually a cure but somehow to prolong the life of the patient, is very expensive and it's not available in the Philippines. It can be procured outside in the United States or Japan. Number three, eventually the patient would require assistance in activities of the daily living. And number four, eventually the patient would have difficulty in eating, swallowing, and would need tube feeding for nutrition.